Diabetes can lead to a lot of health issues, including problems with your eyes. One of the most common eye conditions related to diabetes is called diabetic macular edema, DME. This is a serious condition that can cause vision loss. It's important to get your eyes checked every year, especially if you have diabetes. Even if you don't notice any problems, it's crucial to catch any issues early. If you do have a problem, make sure to see an eye doctor right away. They may refer you to a specialist who can provide the right treatment to protect your vision. Catching it early can make a big difference in preventing long-term damage. When you have high blood sugar, it can weaken the blood vessels in your eyes. This can cause them to leak or grow out of control in the light-sensitive area at the back of your eye, called the retina. This condition is known as diabetic retinopathy. As a result of the leaking, fluid can seep into your retina, leading to diabetic macular edema. This causes your retina to swell, which can affect the function of your macula, the part of your eye responsible for sharp vision. If you have diabetic macular edema, you may not always experience symptoms. However, you may notice that images in front of you appear blurry or wavy, and colors may seem washed out. If you experience any of these symptoms, it's important to see your doctor as soon as possible. Your doctor will ask you questions to understand your medical history, such as changes in your vision, if you have been diagnosed with diabetes, family history of diabetes, blood sugar and A1C levels, high blood pressure or cholesterol, and any other medical conditions. You will also need a thorough eye exam, including a visual acuity test to check how well you see at different distances, and a dilated eye exam to look for any signs of diabetic macular edema such as damaged or leaking blood vessels, swelling, and fatty deposits on the retina. If your doctor suspects diabetic macular edema, you may also need additional tests such as a fluorescein angiogram to take pictures of your retina using a special dye, and optical coherence tomography to photograph your retina and detect even small amounts of fluid and swelling. As a patient with diabetic macular edema, DME, it's important to ask your doctor the following questions to better understand your condition. What is causing my symptoms? Will I lose my sight? Am I at risk for other eye diseases? Do you have experience treating DME? What type of treatment do you recommend for me? What can I expect from it? What else can I do to protect my vision? How often will I need to have my eyes checked? When it comes to treating diabetic macular edema, your doctor may use drugs that are injected into your eyes. These drugs help stabilize the new blood vessels and stop them from leaking, as well as slow down the growth of new blood vessels. The drugs used are known as anti-VEGF medications. VEGF-2 are proteins that can lead to vision loss in people with DME. They cause the growth of abnormal and fragile blood vessels. Most treatments target and block only VEGF. The main drugs used for treating DME include aflibercept, Eylea, bevacizumab, Avastin, fluocinolone acetonide, Iluvien, and ranibizumab, Lucentis. These drugs help stabilize the fragile new blood vessels so they don't leak. In severe cases, laser photocoagulation may be used. This involves a doctor using a tiny laser on your eye to seal leaking blood vessels. It's usually not painful, but you may feel a slight stinging sensation when the laser touches you. In some cases, steroid shots may also be helpful. And in extreme cases, a surgery called vitrectomy may be performed to remove the fluid clouding your vision and replace it with a clear solution. To prevent diabetic macular edema from getting worse, it's important to manage your diabetes by controlling your blood sugar, blood pressure, and cholesterol. This can be done through diet changes, maintaining a healthy weight, and getting regular exercise. Make sure to discuss the best plan for you with your doctor. Regular eye exams are also crucial in detecting symptoms early. Your doctor needs to monitor how your treatment is working, so don't skip these appointments. If you have experienced some vision loss, speak to your doctor about visual aids such as magnifying glasses, in addition to eyeglasses. They can also provide information about resources in your area to help you learn skills for living with vision loss. Living with diabetic macular edema can impact more than just your eyes. It can also lead to heightened anxiety, depression, or other forms of distress that affect your overall well-being. If you're struggling with emotional or mental health issues, it can make it harder to seek care or stick with treatment. To care for your overall well-being with diabetic macular edema, here are some things you can do. Take time to grieve. It's okay to feel sad or frustrated when your vision changes. If your feelings become too much to handle on your own, don't hesitate to talk to your doctor about it. Talk to a mental health professional. Your doctor can refer you to a therapist who specializes in working with people who have diabetes or other conditions that impact vision. They can help you address any emotional issues or behavioral barriers that may be getting in the way of your care. Partner with your doctor. Finding an effective treatment for diabetic macular edema and learning to manage your diabetes with medication or lifestyle changes can give you hope for the future. Join a support group. Connecting with others who live with diabetic macular edema can provide valuable support and information. Your medical team may be able to help you find a support group in your area, or you can look into organizations such as the American Diabetes Association, American Foundation for the Blind, Prevent Blindness, or MD Support. By staying on top of your diabetes and sticking with your treatment plan, you can greatly decrease your chance of losing your vision. This will help protect your vision and give you the best chance of maintaining your sight and staying independent. When your blood sugar stays high for a long time, it can harm the cells in your blood vessels and weaken their walls. In your eye, this can cause fluid to leak into your retina, leading to swelling in the macula. New, fragile blood vessels may grow as a result, leading to changes in your vision over time. Having diabetic macular edema, DME, can cause your vision to become blurry, making it difficult to read, watch TV, drive, or see details clearly. In more severe cases, your vision may become so out of focus that you could become legally blind. The good news is that treatment for DME is effective for most people, especially when you work closely with your doctor to manage your diabetes and DME as soon as possible. There are several factors that can affect how your DME progresses over time, including how well you control your blood sugar, your response to treatment, how long you've had DME, and your race or ethnicity. It's important to work with your doctor to address these factors and prevent further vision loss. With proper management of your blood sugar and treatment for diabetic macular edema, DME, you can potentially regain most or all of your vision. There are steps you can take to live well with DME. Consider low vision rehabilitation. A specialist can help you adapt to vision loss through behavioral changes or low vision aids. Manage other health conditions. High blood pressure and high cholesterol can further damage the blood vessels in your eyes, worsening vision problems caused by DME. Work with a variety of health professionals, including your primary care doctor, endocrinologist, diabetes specialist, optometrist, ophthalmologist, retina specialist, and OB/GYN. Regularly see your eye doctor, especially if you need eye shots for DME. Utilize available resources for blood sugar control and DME treatment, and seek assistance from local or national groups for medication, transportation, nutrition counseling, health screenings, and follow-up care. Learn about disability insurance, especially if future vision loss could impact your ability to work. Discuss all your treatment options with your doctor, including lifestyle changes, alternative medications, and clinical trials. You can find more information about eye conditions related to diabetes on the American Diabetes Association website. They provide helpful links for getting the support you need.